This is what we're going to do today. We'll go through the entire package of the suturing kit and just simply go through the instrumentation, learn some anatomy actually of the instruments and how to use them and what they're used for. The first item, and likely the most important instrument that we'll use for suturing or covering a wound, is the needle holder. The needle holder also has another interesting description. It can also be called the needle driver. So the needle driver is a surgical instrument. It's very similar to Hemostat. There is some similar differences that we'll look at in just a minute. So let's just talk about the anatomy actually of the needle driver. The first portion you'll see is this most proximal end that you're going to put your fingers into. These are called the handles. That handle actually is attached to a little more distal portion, and this is called the arms. The joint is the fixation of where the jaws will actually open and close. So that is the last portion too, the distal part is called the jaws. I'm going to open the instrument right now. You can see it's actually smooth, very short, where you can grasp and drive the needle. So this is the needle driver or needle holder. One important anatomical portion of the instrument that I do want to show you, this applies to all classes of instruments for laceration repair and wound management, is this little mechanism right here. At first, if you're new to instruments, say you're in primary care or you're not in the operating room, you might not be accustomed or actually had formal training. It's sort of a secret and you kind of have to learn on your own. I want to make sure you guys know how to do that before you actually go in and manage a patient. So there's actually teeth around the handles as I rotate it, and if you press into the handles and simply lift one handle up and press downwards on the other, this is up and this one's downward, it releases the teeth. And as I open the instrument, you'll start seeing there's 4 or 5 teeth here that grasp. The only way, simple way you do this is press inward into the instrument and you can hear it lock. And then that's actually the mechanism that locks the instrument. Practice this. It may be good just to open up a package and play with the instruments and become familiar with it actually before you go into a patient care scenario. So that's the first instrument. We have 3 or 4 left, but this is the primary instrument we use for suturing, and this is the needle holder or needle driver. Our second instrument is a hemostat. Depending on the manufacturer of the suture kit, you may find that the hemostat could be curved, as in this one, or they may be straight. And I will show you a straight one after we finish. Let's talk a little bit about the use of this hemostat. The anatomy is very similar, as I said, as the needle driver. So we have handles to put our fingers in to manipulate and drive. This is the arm and body. Of course, here's the joint and the jaws. If you'll notice, the distal portion of the jaws are rigid, and this is what we call teeth. So if you ever hear someone say, I need smooth, or I need an instrument that has teeth on it, that's really what it means. And I hope you can see this in the shot, but it's, as a description, it's just grooved and it helps with traction and holds on to whatever tissue, foreign body removal. You would never grab a needle with this. That's what the needle driver's for. So this is really for manipulating tissue, retracting tissue. In the surgical operating arena, this is actually used to clamp vessels. You can do that with a large venous bleed with a laceration repair or wound repair, but primarily this is used for clamping and manipulating tissue in the presence of a laceration or wound repair. So this is the curved hemostat. I will show you now the straight and we'll compare those. So I'm going to put this down, I'm going to grab the straight. As you can see, this is a straight hemostat. Very valuable if you're going to be clamping something, say that there is a vessel or a piece of tissue that you want to clamp and isolate and maybe dissect out. Sometimes I will use some fatty deposits that I know that are not going to survive in a traumatic wound, and I'll simply clamp those and then use some iris scissors to clamp. So clamping is a really great use for the hemostat. But this is a straight hemostat. Again, the anatomy is the same. You have handles, the body, the joint, and then also the jaws. I don't particularly have any preference for one, and sometimes you don't have a choice because the manufacturer provides these. So this again is a hemostat. It's used for clamping typically and manipulating tissue or foreign body in a wound. So here's the example of a straight, and of course here's the example of a curve. The anatomy is very different, except for there's some small curvature now, as you can see. On the right hand is the curved, and on my left hand is the straight. Let's move to the next one. Our next instrument will be the forceps. The forceps can also be called pickups, and the formal name is Adson Pickups. I typically just say pickups if I need to ask for them, but in most cases in the primary care setting, you're going to be the primary and sole operator, so you really won't have to ask for them. So I'll refer to these as pickups. So let's look at the anatomy. This is very interesting and valuable instrument when you're repairing a wound or a laceration. So what are these used for? So first, they're actually used to manipulate the needle, and that needle you never want to pick up with your hand. It's a really big no-no that you would never want to do in the operating room. So if you were in a primary care clinic, say suturing a very large wound using laceration, you never want to pick up a needle, obviously, because you're going to stick yourself. So this Adson pickup is very important because you can actually grasp the needle, manipulate it on your needle driver so you can suture the wound. So let me just show you this anatomy for this pickup. So on the outer edges on both sides, as you can see, there's grooves, and that provides some rigidity and manipulation, particularly say if it's bloody or wet from betadine or some solution that you've irrigated. So these grooves provide some rigidity and traction so you can manipulate. And then as you go proximal, it's very close, and then distally you'll see the tips actually taper, and this one actually has a teeth. So there is a teeth projection at the end. This helps grasp tissue for picking up and manipulating tissue, actually driving a needle through, as you can quote, pick up tissue, and that's what the name comes from. So this is called the pickup, and we'll use this to manipulate. Now let me show you one little trick about using this instrument. I see all kinds of different techniques. So this is actually the most formal and helpful when you're manipulating tissue. If you can take your index finger and your thumb and grasp the instrument like you're gonna grasp a pencil and begin to write. So it typically looks like this: thumb on the outside, index finger on this side, and I'm simply pinching, and I actually, like I'm using an instrument to write, like a writing instrument. This provides really good control. And if I have to be left-hand dominant to pick up a piece of tissue, and I want to drive with my right-hand dominant for the needle. So it's very important that you manipulate. It requires very little manipulation when you use your index finger and your thumb to manipulate the pickup. So this is a pickup. This is a pickup with teeth, and that's for grasping tissue. And I'll show you a smooth one as well too. One note, this is very difficult if you do have one that has teeth, because these teeth are very technically difficult to pick up a needle if they do have them. So I'm going to show you one that's with a smooth, okay? So this is the teeth. We'll lay this one down. This is a pickup, Adson, same anatomical structure as you can see, but the only difference is if you'll look real close right here, this does have inner teeth for grasping, but it's smooth on the end. And I find this is very helpful when I'm trying to pick up a needle and manipulate it rather than having teeth. So ideally, you want to find one that's smooth, and you can also pick up tissue as well for driving the needle. All right, this is the instrument. A pickup, and the difference between the two is one with teeth and one is smooth. So we'll look at those two instruments. We have one instrument left, and we'll go to that one next. Our last instrument is the scissors. These smaller versions are called iris scissors. They're typically used for cutting, obviously. So the things we want to cut or dissect include the needle thread, so the thread or the suture that we're using, and then also tissue. So there are wounds that you will be required to debride. We'll use a clamping instrument, and then we'll actually get our scissors, our iris scissors, and blunt dissect away with these scissors. Again, these don't have a clamping mechanism like the other instruments, but they do have handles, a body, a joint, and then of course the distal part is sharp. So you should be very familiar with this, just life skills with the scissors. However, they're very important to make sure you have those in your suture kit. This concludes the suture instrumentation, and we'll review here in just a minute what we've talked about today. Hey, let's review now this instrumentation for a suture kit. The first thing we reviewed was the needle driver or needle holder. We discussed that this instrument actually is smooth jaws and is solely for picking up the needle and driving and manipulating. Second, we talked about the hemostat. The hemostat has teeth on the distal jaws, and this is for clamping or manipulating tissue. It is not for driving the needle. That is the needle driver. And there are two versions that may come up in different packaging. One is the curved, and the other is the straight. As you can see, there is a difference in these two. So hemostat, clamping and manipulating tissue. Next, we looked at the Adson Pickup. This instrument is for manipulating the needle and also picking up tissue. We want to use the pencil method or writing utensil, and the difference between these is one has teeth on the distal portion and one is smooth. Preferably you want to have the smooth because you can manipulate tissue and load the needle on your driving needle. And secondly, this is an instrument known as iris scissors. This is for cutting, debriding tissue, and you should be very familiar with these. And this concludes the suture package for instrumentation for laceration and wound repair.